here. So, all right. So, I know you are interviewing at St. Vincent, right? Milwaukee
Yeah,
program.
St.
Yeah,
Vincent, Milwaukee.
very good. Okay, let's get started. So, tell me about yourself.
Um, Thank you, Doctor, for having me here. It's a pleasure to meet you. Um, I am Rishabh, and I am an international medical graduate from India. I grew up in a town called Yamunanagar in Haryana, which is a small town. Uh, so, I am the first physician of my family, and I'm very proud to say that. Additionally, I did my graduation from Kasturba Medical College, Manipal, which is one of the best, which is one of the top 10 medical schools in India. It was attached to a tertiary care hospital, by which I was able, which was a busy tertiary care hospital, and due to that, I was able to become an effective team player, learn about standard operating protocols more effectively. Last year, I did 4 months of United States clinical experience, and which were all inpatient and hands-on types. Two of them were in university hospitals, and other two were at residency-affiliated institutions. Uh, the rotations have made me adapt to the U.S. healthcare system, and they are testimony to my readiness for residency. Additionally, talking outside of the medicine, I am a tennis enthusiast. I love playing on different types of court surfaces. I love to master diverse serving styles. And apart from that, I'm also a foodie. I love to try out new cuisines. Right now, I'm trying Mexican and Mediterranean cuisine. I think that's about me, and I hope we shared the best of our experiences.
Okay, very good. All right. So, can you tell me what makes you interested in our program?
So I learned that Ascension St. Vincent Indianapolis Hospital is a part of a big chain called Ascension. And additionally, I when I was reading about this program, I learned that most of the faculty have already done have their previous experiences at other residency programs. So this gave me a sense of trust that if I am applying here, I'll probably be in very good hands, and they will groom me to become the best kind of physician as per to my capability.
Okay, all right, very good. So, what makes you interested in internal medicine?
Um, there are many factors which have made me lean towards internal medicine. First of all, I love talking to patients. I love the process of building rapport with patients, catering to their anxious thoughts, and building trust with them by teaching them what how we are going to plan your treatment, or how we are going to counsel the patients. I love that process. Secondly, I thrive in an environment which requires collaboration. So, since internal medicine requires a lot of multidisciplinary teams, I thrive in that environment because I am very good at making connections and building a network. So, um, so the multidisciplinary collaboration is something that I really seek, and I hope that I'll be contributing towards it in the best of my capabilities. Thirdly, I love the breadth of internal medicine. Uh, in a single day, I could be seeing patients in the ICU. I could be seeing patients in the clinic, or also on the wards. So, and it keeps me mentally stimulated, and I love the fact that this field of medicine is something that I can do for the rest of my life. These are the few reasons why I love internal medicine.
Very good. So, what do you think the reasons why we should choose you over the other candidates?
Um, Talking about the reasons, I I am a guy. I am a person who actively seeks feedback and works upon it in the most efficient way possible. For example, during my nephrology rotation at Brooklyn Methodist Hospital, I was told by my senior attending. I asked him for the feedback after 3 to 4 days, and asked him about so whether I'm doing a good job or not. Then he said me that yes, you need to work upon your clinical presentation skills, because yes, even I have done my undergraduation from a hospital in India, and the presentation style is quite detailed in India, but we want a bit succinctness in the presentations. So I would stay after hours, read a lot of literature, read a lot about how the style of writing notes, and about how we articulate our thoughts to present our case as well. And within the next few days, I was able to perform much better. I also took the help of residents and other colleagues who have done a few rotations prior to me. So I think it was a great experience, and I learned a lot.
Mm-hmm. Very good. Okay. How many research have you done?
Uh, I have two researches that are published at World Journal of Clinical Oncology and Diseases by MDPI Journal, and I have also submitted another publication, and I am in the process of submitting two more publications to World Journal of Clinical Oncology. But we are still deciding upon the publisher. Either we'll go for World Journal of Clinical Oncology, or we will go for World Journal of Gastroenterology. So
Mm-hmm.
I'm right now targeting these two.
Okay. Can you tell
Yeah.
me a little bit about the research that you have done?
Yes, doctor. So in January, I did a research about gastric mal gastric malt lymphoma, and I think that we used the Sears data set to conduct a retrospective cohort analysis, and we found out since gastric malt lymphoma was a relatively a new topic which was not studied further, we decided to go about the socio-economic determinants of the gastric malt lymphoma, and we found out that uh, if the patient has good social support, he the gender is male, and the um, and the stage of the cancer is stage 2, the prognosis of the patient is very good. But if any of these factors are distorted or worse, the prognostic value goes down drastically.
Mm-hmm. And what's your contribution on that research? What do you prepare on?
So, Dr. Haryadi, my contributions were mainly in in drafting the subsection of manuscript, mainly in the discussion section and the conclusion. Plus, I also did some part of my job in preparing the method section. But since the primary author was also preparing the method section, the amount of autonomy I had in that was quite less. But in the other sections, I had good contributions.
Mm-hmm. Okay. Very good. How do you see yourself doing 5, 10 years from now?
So right now, my primary aim is to be a really good resident and perform really well during my residency. I hope that I'll be getting the world's, I mean, best of best of the experiences here at your program. And at this point, I want to become an academic hospitalist, because which is something that is very intriguing to me, since all the rotations that I had were with academic hospitalists, and I am aiming to become like one. Uh, Additionally, if I find some subspecialty very interesting to me during subspecialty rotation in the residency, I might take up that path. if I feel that this is good for my career growth.
Okay, all right. So, what do you see in the academic hospitalists since you've been rotating with them? What do you find intriguing for you?
So I when I was at HCA Arlington, which is I did a rotation in Texas,
Uh-huh.
and it was an internal medicine rotation, and my program director it was with the program director, and I learned that this job requires a lot of scholarly work, which we can do. Secondly, it required administrative work, like presenting your patients to the multidisciplinary rounds to actually look at the how we are able to manage the patients efficiently. And thirdly, the we apart from teaching, we were also in the clinical setting at all times. So I think these three factors are crucial for me, and I am looking forward to do all of them. And I think that I am a great fit for this type of career.
Okay. Um, what are the typical scholarly activities that you see the academic hospital is doing? Give me some examples.
Sometimes, for example, sometimes the residents need some quality improvement projects, and they need some guidance regarding how to conduct those studies or how to actually go out and publish them, or maybe uh, um, making a part in the journal clubs, setting up the discussions for
Oh,
journal clubs. I think these are the two things that require both resident and the professor's involvement, and the
okay,
culmination of both leads to better outcomes.
okay,
So
okay.
I want to be actively involved in that with my
Uh,
future residents.
okay, okay, got it. And what do you think? What do you see in our program that you think you can achieve? Do you think you can achieve that through our program?
Yes, doctor. So in the Residency Explorer website, um, the your team has mentioned that you have an individualized training curriculum for the residents, and I think that that is something really beautiful about your program, which makes me quite which makes your program quite appealing to me. And
Mm-hmm.
I do have some questions about it, like when would 6 months of training begin, and how will it cater to my career? But I'm still hoping that this will work in my favor, and whenever I get the time to ask questions, and I'll ask about that at that time.
Sure, I would love to know that. You have any questions about the program?
Yes, doctor. I wanted to ask, when is this individualized mentorship program is usually inculcated in your curriculum? For example, is it in first year, second year, or third year? Uh,
Oh, okay. You said you said individualized residency, meaning
mentorship.
like a mentorship, the
Yeah,
mentorship part, when it's
yes.
one on one. Oh, okay. Well, of course, I don't have the answer to that. I don't know. But
Okay.
that's a good question. Okay, very good, very good. Um, Now let's move on to the this question. Tell me about the time when a patient make an impact for you.
Um, when a patient made an impact for me.
Yeah,
So by this question, do you mean like how the patient made me learn something, or it
make you
changed my
learn
perspective?
something. Yeah, make you learn something. Mm.
Okay. So I- it was quite an interesting day at the ER during my internship, when there was big, like a heavily built guy, patient who was in 40s of his age. He came up to the emergency department because of chest pain, and he was shouting on the nurses and other ancillary staff. When I got there to ask him about the history of his, he told me to like go back, and that I don't want to listen to anybody, and I don't want to answer any more questions further. At that time, I realized, I told him, I said that, sir, you look extremely frustrated. I apologize for any kind of misunderstanding or the discomfort you are handling. But is there anything else that is bothering you? At that point of time, the demeanor of the patient changed. He started, to my surprise, he started crying, and he said that I have a family of, I have two kids and a wife, plus two parents. I am a mason, and I don't have enough money to support my family. If I die, I won't be able to sustain them, and this way I'll become a failure for my family. Plus, this chest pain is making my life worse. At that point of time, I called my resident also. We, we got the other tests done like EKG and cardiac enzymes. We also had a chest CT done, and we found out that he had pulmonary embolism. But the learning point from this was that if we listen to the patient very carefully and empathetically, we find that the reason for their agony is also because of some fear, or or the pain which makes them really unhappy with their life. And after we are able to know that thing, we can actually build trust with the patient, improve treatment adherence, and which can lead to better outcomes. And this is something really beautiful about this field of internal medicine. And I also realized that there are many dependents on a sole breadwinner. Since internal medicine caters to majorly to that kind of population, I am really proud uh, to be in this to pursue this field, and I think this will lead to a greater personal and professional satisfaction for the entirety of my life.
Okay, very good. Tell me about your tennis experience. I want to know a little bit more about that.
So yes, doctor, thank you for asking me that. I've been playing tennis on and off since childhood, but I was peaking at my sport when I was in ninth or tenth class. After that, I had to stop playing tennis because I had to prepare for my entrance exams. But soon after I got into college, I started playing it again, and I was elected as the member of sports committee, as the head of a lawn tennis team, and it was such a great experience. I had one of the best team, and we performed really well in the intercollegiate events. Plus, we also helped in organizing a intercollegiate fest for the tennis uh, for the tennis enthusiasts, and we have done a really good job. We would go through each and every aspect of of organizing the tournaments. For example, making the fixtures, deciding where to accommodate the participants, or how to decide the timing of the courts, and how to also make rest time for the participants, because it was kind of difficult to uh, actually organize the event in a 3 days time. So yes, we did all of them. We did it very smoothly, and our efforts were greatly appreciated.
So it's between college, right? The
Yeah,
competition is actually between college and all this.
between different only medical
Yeah.
different colleges.
Have you ever played tennis against people in the U.S. when you were here? I was wondering about that.
No, no, doctor. Due to the time constraints and my heavy
Oh, yeah, of
clinical
course.
rotations, the only thing that I could afford, or maybe do at my downtime, was going for walks with my fiance, and I think, or maybe
Yeah.
trying out some new cafes or new coffee drinks, and I think that is
Mm-hmm.
much about what I did in the U.S.
Too busy. Okay.
Yes, doctor.
Um, yeah. Do you have any family in Indiana? Um,
No, doctor.
yeah.
No,
No.
it's I have a cousin who I have spent the majority of my teenage life, and
Hmm.
he's in a course of computer science at University of Wisconsin-Madison, which is like 45 minutes away from the hospital. And I think this is something really exciting for me because I have not met him for like 4 to 5 years up till now.
Uh,
And
okay.
additionally, since he has been telling me a lot about Milwaukee after I got the interview from your program, I think that he will also be a great help in making the onboarding process really easy for me. So having him is a great asset for me, uh, for my
Yeah.
social support too. And I believe
Yeah.
that as an
Yeah.
IMG, I have no other
Uh-huh.
social support in the US except for him.
Oh, okay. Yeah. Yeah. Got it. Okay. Very good. You have any other question for me?
Yes, doctor. I wanted to ask. Um, just a second, doctor. I have a long list of questions, but due to time constraints, I'll keep it to like 2 or 3 questions.
Uh,
Uh,
yeah.
so, what procedures can I do as a resident, and are there a number of procedures that I need to do before graduation?
Okay. I'm just gonna make up things here. The typical procedures that residents supposed to be able to do, usually there will be a kind of like a logbook that you're gonna check if you have done that. But the typical ones would be arterial lines, central lines, and then paracentesis, and then pleural tap, spinal tap. Just the common ones. Also, you're supposed to know how to do a pelvic exam and then do a pap smear, but we have ambulatory clinic for that, women's health, so I don't think you have any problem with that. In addition to that, usually people can get that experience in the ED. That's where people can get experience from. So those are the usual procedures that our residents have to do before graduation. So, yeah. Mm-hmm.
Thank you, doctor. Thank you for answering me that. That
Uh,
was
mm,
amazing explanation.
yeah.
Thank you.
Yeah.
Additionally, I want to ask, what uh, is there any POCUS curriculum?
There is focused curriculum. Yeah.
So that would be in the first, second, or third year. Which year would it be in?
Now that, of course, I don't know. Let's say it's a second year, third year. That would be my answer.
Okay. And
Yeah.
thirdly, the last question that I have, if I have to be residency ready, what else can I do as a student right now so that I am able to adjust to your program from the day one?
Okay. That's also a very good question. Well, you have done a lot of hands-on US experience, so I don't think you will have any problem adapting. Um, Usually, it's going to be more of a logistical issue. Like you need to get used on the time you come in, the environment, the EMR that we use, right? And then you need to get used to the presentation style that we use. Just to getting used to all these, well, there's going to be a lot of new things you need to get to used to, but I'm pretty sure you can adapt very quickly. I mean, you have been on multiple locations, right? You've been on multiple university hospital doing hands-on, and I believe I read your personal statement, you've been on multiple places in India as well. So I don't think you will have any problem adapting. I think you'll be ready.
Thank
Yep.
you, doctor. Thanks for having me here.
Okay.
And
Very good.
I would say that I have all the many reasons to be at your program, and
Yeah.
I'll be contributing to the best of my capabilities. Thank you so much,
Okay.
doctor.
All right. Very good. The way we gonna do this, let's see. If I click, you know what? I'm just gonna use my memory to do that, because I usually click stop recording, and then there'll be a transcription there that we can see your whole answers. But yeah, I'll just use my memory, and then you remind me what your answer is. Okay, so I'll comment about everything. Now you have the best setup that I've ever seen. Yeah, of course. I mean, your camera looks really good. So you use what? Oh, you use iPhone for your camera. Yeah, it looks pretty good. I was wondering if you can move a little bit back, uh, and then
Yeah, yes,
and then
doctor.
your chair has to be, yeah, your chair has to be going up a little bit. You need to have a higher chair, so it's close to the upper frame. uh um, but even the setup that you had is really good, because I think it depends on that camera. What's it called? The focus of the camera. Sometimes you're able to use your hands, and then I can see your hands. There are moments where it's really good. Try to stand. I mean, sorry, sit up as tall and with a tall back. Okay. I think
like
the
the
previous one is, yes, yes. And then when you use your hands, I can see your hands when you were talking there. That's very good. Yeah, yeah. So this is
actually
good. But even
okay.
before one was actually pretty good. Yeah, I
Okay.
actually like it. Yeah, yeah.
Thank you,
So
doctor.
this looks good. I like it. Okay. It looks professional, but I know it's your bedroom. You probably hasn't set up your whole background yet. I don't know if you
No.
have trophy achievements, your tennis, whatever. Okay, so those are the things that you can do. Internet connection is really good, very very stable. I don't have any issue with that. Your pictures are clear. You have a great light. I can see your face clearly. At
Yeah, it
least with
was
this setup, it looks very very good. Ring light,
yeah.
okay.
Yes.
At least with this one, it looks professional. That's what I like about it. So you can use the setup. It's just a matter of maybe you can personalize your background a
Hmm.
bit. So that's about that. For the what
Doctor,
else? The next one was, yeah.
can I take
Hmm.
a minute? I just need to grab my notebook
Oh yeah,
to
go ahead. Yeah, yeah, yeah. I
yeah.
know to write down, right? Mhm. Okay. So another thing is, I notice you use maybe a swivel chair. Your chair maybe can move easily, so you just have to be careful. I think sometimes I see a non-verbal gestures where you kind of swivel. Uh, the best one is if you have a chair that's just chair. They don't swivel. They don't move. Just to reduce the chance of you doing a little bit like this, especially if you don't notice that you're actually moving quite a lot.
Okay.
Um, and then, so hold on, let me see. I have a checklist. I mean, we have the checklist, right? Checklist. Okay. Okay. So good eye level, lightning, good background, attire perfect, internet is perfect. Um, you have a wired one, but because of the iPhone, barely able to see it. Um, Again, I recommend the earphone Bluetooth, especially if there is no lag. Your camera is good,
Uh,
eye
I, I
contact's good. Okay. Mm-hmm. What's
I
that?
wanted to use the AirPods, but I realized that there is some form of latency which is observed. So
Delay?
I
Okay. If
latency.
it's delayed,
Yes.
don't use it. Yeah. It's laggy, so don't use that. That's right. Even this, it's okay. I'm I'm fine with it, because of the you blurred the background, so your this also blurred, so I'm barely able to see it. So you still look professional, and I'm okay with that. Um, yeah, sometimes you are actively using your hands becomes more. There is more connections with that, so I would like you to use the hand gestures more. It becomes more natural when you do that. There was a moment. I mean, I recorded so you can see yourself. There's a moment where you explain. I think that was when you explained the story about that story was good. The story about that man that comes to the emergency room and then he he's shouting. He was not cooperating and all those. Then you use your hands more, and then there's more connections in there. So those are great moments for you. You have no problem with accent at all. It's so easy to understand you. You have enthusiasms, you have pitch and a tone, and all those. There are some filler words. You probably noticed that. There's some filler words that's well, probably initially you got a little bit nervous, but then it gets better. All right. So those are all the non-verbal and then the focal image. There is one thing that I want to mention about the. It's not exactly about the focal image, but I think there are some words that is not conversational. This is one thing that I didn't mention in the management interview course, um, which is I want you to stay professional but conversational. There are some words that you use if we look at the transcription. These some of these words I doubt that you ever use in conversational settings. It has to be some form of a memorized words. That's my guess. Yeah. So you use some of those. Now I have to take a look at the transcription again, and I can point it out to you. What are those words?
So,
But do you use a script or just pure frameworks, and then you don't prepare any script?
no script.
There was no scripts. Okay, that's good. So I guess it's just the choice of words that has to be more grounded. I guess make it more colloquial and more conversational in order to create more connections. Mm.
Like
So I
using
will
simpler words, basically.
using simpler words, conversational words, colloquial words, in order to connect more.
Thank you, doctor.
Um, sure. Now, now let's take a look at some of the tell me about yourself questions, right? So you have to help me with this. You have to remind me. So you start with I like the part where you tell me that you graduated from a top medical school. Perfect, right? Because that creates professional qualifications. You also mentioned that you went to you were trained in a tertiary center hospital where there it's busy. Now I recall there is some descriptions that you put in the tertiary care hospital. What was the word that you're using? Do you remember? There's something
Busy,
there.
busy
Uh,
tertiary care hospital,
busy tertiary care hospital.
which
Okay.
has made
There.
me like make me good for following standard operating protocols and also an effective team player. I said that.
That's the word. That's what I was looking for. It's better to get rid of those.
Like SOP.
Find something that more grounded.
Okay.
Let's describe that just a little bit. What do you mean by standard operating protocol?
Like for example, if a patient is going for surgery, there is a set of guidelines that we need to follow. For example, for a pre-op evaluation, we need RFTs, we need glucose, like renal blood sugar, sorry, fasting blood sugar, and his HbA1c, HIV testing, hepatitis B testing. All that panel includes a lot of things. I think this is the way it goes. Or maybe if we are admitting a patient under this team, so if the patient is going for a orthopedics consult, sorry, not consult, he's coming for orthopedics primary complaint, so he will be there in the orthopedic ward. Even if he is having some kind of septic shock, he won't be going to the internal medicine department. I think those are some standard operating protocols that we followed in our hospitals, in our hospital.
Doesn't mean much for the U.S. system.
Okay. Okay.
Mm. The thing is, these I don't know if you use Epic in one of those hands-on.
I used
Um,
Epic in three of them out of four.
they have an order set.
Yeah,
You won't use it.
exactly.
So yeah, so they have an order set. Um, how I understand it, if it's a tertiary care hospital, it's the complexity of cases that stands out. Mm. So, what are the complex cases? Quick example of complex cases that you handle in your when you were in India.
Uh, the complicated cases would mostly be around infectious disease spectrum because the amount of sheer cases we'd get about infectious disease is so much more. Uh,
Give me
so
example of the cases. Like was
for example, um, we we had a time in our infectious disease ward when everybody was having cytomegaloviremia. It was difficult to detect from where was it occurring from, but then we realized there was a patient in the oncology department who came to the infectious disease ward because he had CMV viremia, and after that, everybody in that same ward uh, got that viremia. And I think that was a very difficult case to diagnose, and not many patients could make out alive.
okay. Let me make it more. We have to correlate that into the St. Vincent's, if I recall it correctly, is a community-based hospital, right?
Yeah.
Yeah, community-based hospital, but they are referral. Okay. Ooh, okay, this is one of the homework that you need to do. You need to know the patient population, the type of cases that they handle, the complex one in St. Vincent. Um, and then you're gonna find a similar one in your country. So, for example, if they say that they handle maybe transplant patients and they got the sometimes infection of CMV type of infection, right? And then basically you're gonna describe that I did my hospital is tertiary care, and then the cases are complex like these patients, and then you mention quickly about the patient cases. Now, if you know that those patients are also type of cases are also seen here, you correlate that I already able to taking care of these type of patients and become more comfortable with it. You see,
Yeah,
so you
that's
show
a
the
really
fit.
nice point, doctor.
That you see show the fit. Yeah. So the standard operation protocol and teamwork is so abstract and it's not grounded. And yeah, it's that words is like a buzzword. Let's put it that way. You see, so I like it something more grounded. That's more tangible. Mhm. If you can find any, I would rather you say I do tertiary hospital and then I used to handle a lot of complex cases.
Okay.
That is in the level of university level. They understand that, and at least they feel, at least what they hear is as if that you went to the tertiary hospital like in the U.S. Of course, it's gonna be different, but that's what they hear. Just like when you mention the U.S. healthcare system, what they hear is insurance, but what you hear is how you want to deliver the healthcare in the US. That's the healthcare system for you. But healthcare system for the US people is going to be about insurance and payment. You see, sometimes one word can mean differently for the other person. Depends on that what that other person know. So tertiary in the brain of the US doctors would be transplant patient, would be those with the complex oncological cases. So Whipple surgery, maybe ALS. These rare diseases. So this is the brain of the people when you say tertiary care. You know, that's what they think. It's well be gonna be different than tertiary in India, and
But
gonna be different tertiary in
but
Indonesia. So.
but I think our hospital was, I, it is actually quaternary care, but I was mentioning tertiary because since um, the new accreditation for our hospital got rejected for quaternary care, so that I was avoiding that.
Oh, okay. Sure, 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 sure. Got it.
Yes.
Yes, 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 yes. So then that's good. Then that's good. It's better to just tertiary and then talk about complex cases rather than the other buzzwords. Okay, and
Yes.
then you mentioned, okay, we'll move on. And then you mentioned about the other professional qualifications that you have is that you have done multiple US clinical experience. Those are hands on, those are 4 months. So I like that one. And then you mentioned about the fact that you were the tennis part and then enjoying the food. I like that one too. Now, I guess my question is there a reason why you chose that you did a 4 months hands-on USCE is as your professional qualifications? Is that on purpose?
So no, I think um, if the way I wanted to frame it was that 4 months of clinical rotations have already made me adapt to the US healthcare
Sure.
system,
Correct.
and
Correct.
so um, the they have made me residency ready, and I'll
Sure.
be able to perform really
Makes
well,
sense.
and I won't need much of teaching and much of running around after myself to actually teach
Mm.
me what's going on and what's not going on. So I
Yeah.
think that was a game changer. And additionally, sometimes people have observerships, so that keeps me over the edge. That yes, I have done clinical
Mm.
electives, and I was active um, during my internship year to do that. I
Okay.
think yes,
Okay.
that was the reason why I
So
mentioned.
okay. So the my feedback on that, tell me about yourself, is you like the maximizing the program fit. Mhm. That I think that's where it's lacking, and then we can improve that. So, like I said in the match with one interview, right? So you want to choose maybe 2 out of 4 professional qualifications, one personal. But the two that you choose would depends on. Hold on. Yeah. The two that you choose would depends on the program itself. So I did some research. Actually, you know what? Before I tell you what I did about my research on the Saint Vincent, can you tell me what you know? Tell me everything that you know about Saint Vincent internal medicine program
So
in like the next 5 minutes.
okay, there are a lot of things. It's a very new program. It was accredited this year only, in 2025.
Okay,
The curriculum is one of the best. I think it has Yale-based curriculum, and the faculty over here is very much has done a lot of things in their lifetime, and they are doing a really good job. Additionally, it is a 12 it has only 12 categorical positions each year, so the close knit environment that I will get here is unparalleled. Additionally, the program directors the warmth of the message from the program director is a lot more than any other program. So the collegial environment that I'll be getting over in St. Vincent Hospital is and it's unparalleled, and I think I need to be at this program. I really loved it.
what's the name of the PD?
Vaishnavi Bhaskaruni.
Oh shit! So that means I'm looking at a different program. Isn't it the Ascension St. Vincent's Hospital, Indianapolis, Milwaukee program? That's what you sent me, right?
Yes, doctor. It's difficult to reach. Can I actually
Give me
send
the
you?
website. Yeah.
Can we chat? Yes, we can
Yeah, yeah, yeah.
chat.
Click the chat. Yeah.
Just a second, sir.
I typed that one yesterday and then
It won't come. It won't come.
oh okay. That's fine. We'll do it together now. It's okay.
Doctor, I want like on the day of your um, live classes. I had asked you one question, like how to think fast and how to articulate our thoughts well. So according to you, was I able to articulate them well or not?
There are mm, it's I think I would say on your level right now, I would say you're doing very, very good. Of course, there's how sky is the limit. There are people who are okay. Now I found it. Okay, I'm gonna share here. Oh, do I have to share entire screen? No, I don't have to. Okay, there you go. Okay. Okay. Let's go. So, is he okay? Nicole. These are the people. I need the curriculum.
Yeah, yes, it's right there. Yeah.
Okay. What's this? Okay. What's CMS? Columbia St. Mary?
Yes, yes.
One block ICU. Okay. PGY3 has more. Okay. EP. Hold on. Okay. So emergency medicine is actually first year. Mm. Active care service. Columbia St. Mary is the hospital, and then there is two sites, two hospital here. St.
Yes,
Joe's.
doctor. Yes.
Mm. Endo room himong. Challenges. What about this one? Oh no, this was internal medicine. Okay. So where is this located? Is it Wisconsin or Indiana?
It's
Wisconsin.
in, it's in Milwaukee, Wisconsin.
Oh, Milwaukee, Wisconsin. Ah, okay. Right. I don't think they do 4+1.
Yeah, that is also a question that I made up for them to know about more about the curriculum because it was difficult to extract what the information was there.
Okay. Um, it's a new program that just opened.
Yes.
Yeah. Yes. 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 Yeah. Yeah. Okay. Um, we really will require some more creativity here to maximize the fit. Because the reason is what they have here. I don't see anything special, unfortunately. Yeah, I don't see anything special. All these things are you can get it in any residency program, and understandable because they are a new program. So there is nothing really stands out. These are all the things that you can get in any program out there. So interesting fact that the if you want to make the case of a strong case why you're interested in the program, a tangible outcome of curriculum, I just cannot find it over here. It's very hard because they don't really give much. If there is anything that you can get, it's going to be more on the outpatient stuff. Like this one is a little bit special here: obesity medicine, pain medicine, EP, or EP vascular. Those are the one, and then psychiatry. Not all internal medicine program will provide some psychiatry, obesity medicine, and pain management. So the ambulatory has some subspecialty electives, but I don't think there are 4+1. I think you probably have 1 or 2 days ambulatory per week, something like that. That's kind of like my guess. And then this ambulatory clinic here is probably your choice, whether you want to go for pain management, obesity medicine, or some sort.
Okay. I
That's
think that
my guess. Yeah.
I think that since the duration given for the thalamus interview is around 2.5 hours, so there would be some resident presentation which will be going on. So they will be able to make a better case out of this thing so that we are able to understand what's there in the curriculum. I think this should not be our primary goal. I think what we can do is align with the mission statement at this point,
Correct.
like doing.
That's right. If you cannot do that's what I'm thinking. If we cannot do more of the tangible outcome, because usually the tangible outcome that to create a clear payoff is going to be the curriculum. But since we don't have that, we will have to use a little bit more abstract stuff where it's actually aligned with their mission. I agree
Yes.
with that. Now, there is one fact which is you said 12 residents, right? There will be
Yes.
12 residents, So you already mentioned that, and I like the fact that I think you did mention that because of this close knit community, you will get a very, you know, close attention, and then you can learn better with a smaller group. So that
Yes.
is a strength. Yeah, a smaller group is a strength. Certainly. So that's something that you can bring up. Um, that actually also means that I think what they're this is my feeling. What they're looking for here is more of a personal qualifications than professional qualifications. That is in my opinion. The reason is when you describe, especially in the smaller program like this, they just want a really good person that they can work with. You are already qualified. What's your step to CK score?
Same as you, sir.
To 61?
Yes.
Okay. So, see, you are already qualified professionally. You have 4 months of hands-on experience. And I think that means that the way you describe the tell me about yourself is already accurate, because it seems most likely that's what they're gonna look for. People who are ready to transition. They're not looking more on toward, let's say, if the program has robust research, right? And then you're gonna say, oh yeah, I'm interested in research. I go great good with research and all those, right? Um, and then so they looking for people who have these professional qualifications and able to do that, right? But this is not that. Since this is a new program, I think they're just really looking for somebody who is
Ready.
ready. No, the interview they're gonna look for somebody who they're easy to work with, a higher warmth.
Yes.
So that's what you need to be able to communicate with them. That because they're close community, there are only 12 people. If the 12 people and the 12 cause problems, they're gonna go crazy. You see, so they have to find people that is really really easy to work with, people who are very flexible. Um, so you're gonna put more on the higher warmth on this. Like the balance may be a little bit more like 30 per during the interview. Okay, during the interview would be 30% ish professional qualification, but 60% is a high warmth. Because you
So what?
qualified. Your steps to CK is 261. You said that you have a 4 hands-on experience, right? Hands-on. So they show me ready, and I think that's already enough for them. Great. This guy will not have any problem. You communicate that very very well. Then you move on toward a high warmth. So when you talk about your tennis experience, you go a little bit deeper, on that and that story. What else? Maybe they ask you more about what are the food that you have tried in the U.S. and some sort. Um, and then when they ask you about, okay, this is the issue here. You mentioned about academic hospitalists. Okay,
Yeah. Yes, doctor.
that could be an issue. But you mentioned that in your personal statement, right?
Yes.
Yeah. So that's a little bit worrisome. Um, because they might think cannot give the things that you're looking for. Because academic hospitalists would be more of a university hospital, especially if you say that I've been rotating university hospital, I'm interested to become academic hospitalist. They will feel like, can I give this to this guy? You see what I mean? I don't know if that, I mean, I'm not coming from the program, so I don't know um,
I think
if you can. Yeah.
even a program director is an academic hospitalist. I don't think this would be an option. Like this would be
Okay,
a
cool.
very some.
Okay, cool. Yeah, okay. So what I'm trying to say is, you don't want to communicate to the program that you want to graduate as a hospitalist from an academic university type program. I guess that's the idea that I want you to avoid.
Yeah, yes.
Um,
So I what I wanted to say is like I want to become a hospitalist, but I also what if I change it to clinician education track?
do they have that?
No, no,
I
no.
don't think so.
I mean, um, I want to be clinician educator. This kind of thing. No.
Mm, that probably work. Depends on how. Um, depends on their presentations, really, what they have to offer. Um, you have to
So
fit on what they have to
what could
offer.
what could be a good answer to that? Like just saying hospitalist.
It based on what I see here, they aiming more toward hospitalists, just
Okay.
hospitalists. Yeah,
Okay.
just based on the curriculum. I mean, I don't know. I've never gone to the program, so you will need to find out during that day. Um, but based on this, it seems like they just go. If you also when you see here one block, let me see, two blocks, two, three. So they have a 4 blocks of ICU total. Okay, 4 blocks. I got 6 blocks in my program. We have 3 months on the first year, so there is not a lot there. Very standard, I would say.
Yeah,
It's
very
very
standard.
standard, very standard. So yeah, I think they just looking for more warmth during the interview. Make sure you're able to communicate that. Um,
So according to you, was I able to like get into the warmth status?
what were your answer when we let's explore your answer here. What were your answer when you asked about the internal medicine?
I told
Why
that
you want to become internal medicine?
I
Hmm.
love to talk with patients and I love to counsel them. Secondly, I thought I said that I thrive in a multidisciplinary environment. I love to do teamwork as I'm also very charismatic and personable person, so I'm easy to work with. That's what I said in the second point. And in third point, I said that I love the breadth of medicine. I could be seeing patients in ICU or the clinic or the wards in a single day, and that keeps me mentally stimulated, which is something that I can love for the entirety of my life. I said these 3 points.
Any personal example? Did you give personal example?
No, I did not give personal example for this.
Uh, so if you want to communicate more warm, picks. Okay, one is the love talking. Okay, so the warmest one out of those would be the talking, because if you work in the multidisciplinary and then teamwork and all those, that's more competence part, right?
Yes, yes,
So if you want to be more warm, that means we have to choose the you love to build the relationship with the patients, or in a multiple different settings. We can combine those, right?
okay,
You
okay,
can
okay.
be you discuss it in the ICU, you discuss them in the ward, but you also see patients and then communicate with them in the outpatient settings, right? Then you need the personal examples. That's warm. Mhm. Yeah, yeah. Just focus on that. So those are one of the examples how you can tweak it, like based on the program. I mean, unfortunately, this program doesn't have a good curriculum, so we tweak it in the warm part. And then I asked what your goal 5, 10 years from now is. You mentioned about being the academic hospitalist, right?
Yes.
Okay. Um, and then when I asked you, oh yeah, your unique strength. Yes. What was your answer on that one?
I
I
love
think
to
it was.
take feedback, and that is the only that is the because for me that is the only way of making tangible growth as a physician. And whatever the feedback is, I take it very seriously and work upon that. And I gave that example of nephrology rotation when my attending said that you have very detailed presentation, but you need to make it more succinct.
I like that one. That works very very well. Yes,
Okay.
that works. Especially, it's very connected. Your strength is connected to what they're looking for, right? There are 12 people. They need to people have those people that easy to be taught. And then you said that that was your strength. Uh, that you were very open to feedback, and then you give the example as well, right? When that happens during that rotations. Good. I like that one. Um, the delivery, make sure it's as warm as possible, meaning that you do it in story form, like the way you did the story about that guy that comes in the emergency department and then shouting to people, and then when you try to calm the patient down. Okay, so you have to make it a little bit more in story form, right?
Okay. Okay.
Um, yeah, just expand the put a little bit more of a rich details. Yeah.
Okay.
I was doing dissertations, and then I was doing these presentations, and then I was asking for feedback, and then they mentioned to me this is what the issue is. And then of course in this all these type of situations, your learning point and what's the impact, right? After that, what happened, and then you have improved your in your presentations, and then they're happy with. Yeah, good. Yeah. The research will not be as important. I don't even see a research block over here. Do you see?
No.
There is no research block. Um, oh, when I asked why you're interested in the program, I think you mentioned about the mentorship, one-on-one thing.
And yes, it's not
Oh,
written here. It's in Residency Explorer.
oh, it's in
I'll give
Residency Explorer. Okay. Yes, yes, yes. So
I'll
that is good. I
yes.
like it. Yes. Um, and then, did you mention anything else? The faculty, I think, that comes from
Faculty is
multiple.
really experienced.
Okay. Mhm.
Doctor, like what I am thinking of this program is that it's really a gold mine. For example, if you go through the hospital details, it is like it is made like a five-star hotel or something. Additionally, it has 457 beds plus 61 additional emergency department beds. This is more heavy in infrastructure than maybe John H. Stroger Hospital or maybe any other hospital that we can think of in community setting. So this is a diamond mine for me actually. But yes, the curriculum needs to be built up. The residency training will build up as I grow as I grow in the setup of residency.
Okay. So, when you join in, there is no PGY2 then.
Yes, there is no there is one PG. There is yes there will be PGY2.
Oh, okay, okay. Yeah, yeah, yeah. Hospital and patient population. Yes, so that was one of the strength, right? So I haven't done that research on the Columbia St. Mary's Hospital. Um,
So I can tell you about that.
yeah,
This
go ahead.
hospital has around 30,000 patient admissions and about around 50 to 90 to 150 taking each day. So and additionally, sorry, there are 30,000 emergency department visit, and out of those, like 100 patients are admitted every day. This is the footfall. Additionally, they are a community hospital. They are also attached to Saint Joseph Hospital, which is a safety net hospital. But that rotation is only for 1 month.
Okay.
So Yes, so I'll be rotating at two hospitals mainly, but
Uh,
Columbia St. Mary is the one that is built like a fortress.
I see. Okay, I see. So you
Okay.
actually, is that in Milwaukee? Yeah,
Yes, it's in Milwaukee.
Columbia St.
It,
Mary Hospital.
the
Yeah.
campus is so beautiful. I can't get over the campus. It's along the shore of Lake Michigan. It's beautiful.
Oh yeah, yes. Ascension Columbia St. Mary. Okay. Mm. So the hospital and you're rotating to is really good. That's that would be a plus part. Yeah.
Yeah.
So you can definitely use that one too. Um, I don't know how diverse the five patient population is going to be, but are they a referral like tertiary type of hospital?
There are a referral hospital. Yes, tertiary
They're a
care.
referral hospital.
It's
So
a
you want to.
level
Mm-hmm.
4 trauma center and level 2 stroke center.
Mm-hmm. Okay. So all right, very good. Uh, yeah, you can definitely use that the patient populations. Um, find out a little bit more about the diversity of the patient population, the type of cases that you see, you know, and if you again, like I said, if you manage to see the fit, well, I mean, I thrive in this because this is where I graduated from. Right in India, I was trained in a tertiary care, you know, so that also makes it a good fit for you. Mm-hmm. Cool. Okay. All right. Um, all right, very good. Do you have any other question for me?
Yes, doctor. Like,
Yeah.
if I say that you, as a program director or maybe as a mentor, if you had to rate me out of 10 for this interview, how would you rate me? If keeping aside the fit for the program.
Okay. I'll put 4 out of 5. It was pretty good.
Okay.
Um, I think the part that a little bit lacking again, we'll have to use a different, more grounded words, more
Okay.
conversational. You
Hmm.
stay professional but conversational, because that's
Okay.
the only way for you to be connected. Mm. Yeah, to that the people that interviews you. Mm. So yeah, that's probably my main feedback. Now after this, I'll take a look at the script, and then I'll give you more specific feedback on every
Spec.
sections.
Okay.
Yeah, yeah.
So okay.
I'll give you
Um,
more specific ones, because we have the recording, so I'll give you that as well. Yeah.
so at this point of time, I just need to like go through the program again and again so that I have points in my brain to speak them out.
Yes. But remember, I think for this type of programs, you have to make sure you have a good warmth. Mm-hmm.
Good one.
Because they're
Okay.
gonna be looking for that more. In Yeah, you can imagine there's only 12 residents there. So
So, in terms of
yeah.
warmth, was I able to maintain like good eye contact and a smile on my face and the overall feel? How was it for you? Did you feel warmth from my end?
So you have a good warmth in the beginning. You smile. Yeah, yeah. Uh, I think you smile appropriately. You give as you give your answers. I think that was good enough. Uh, I would
Okay.
say so. Uh, so some of the answers maybe again you have to tweak into more of the high warmth side. Hmm.
Okay.
But I guess that's about it. Yeah. Again, I'll take a look again in the recording, um, and then I'll give you more specific detail on tweaking on the answer, and I'm gonna try to tweak it into that program. Um, the thing is
And
that again, I was looking for a completely different program. Yeah, I mean, when I searched that's this completely different program than this one. And I was actually excited to, okay, and then I look at your personal statement, I look at your CV and everything, and then I already prepared the whole thing that I think is gonna be really good for you for that program. But yeah, got the wrong
well,
program. Yeah,
were my
so
so like, okay, just last two questions, doctor. Like, were
okay.
my answers adequate and the way I articulated them in the speech, my voice modulation, was that okay?
Yes, for the non-verbal, I mean, sorry, for the focal image part, those are all good.
Mm.
Um, Again, it's more on the choices of words that we can make it
Choice
more
of words.
grounded.
Okay.
But it is, I would say, it does takes a lot of practice to choose a more grounded and colloquial ones. Um, I would say in the level where you are now, and then if you compare it to your other peers, you're already really good. Yeah, it's already
Okay.
pretty good.
So
Yeah.
yes, I have the interview on 20th October, Monday.
20th? Okay. Yeah. All right.
If we can meet again, it would be really good. So if I'll look at your availability sessions
Sure.
uh,
I
up till
should
20th.
have.
Yes.
Okay. All right. Mm-hmm. Sure. Well, I'm sorry that I've got the wrong program.
Oh, it's fine. It's
I would have
fine.
prepared
It takes
way
place a
more on
lot.
that. Mm-hmm.
Because even
Yeah.
if you go through the entire curriculum once or twice, you won't get anything very specific or very like glittery.
Yeah.
And I think
Yeah.
it's fine to go for the mission statement or maybe like do a bit more research about the program director. Like she has the statement called "First, do no harm." So I prepared my few questions related to that also.
Okay.
Yeah,
Okay.
I think that I
Okay.
have done my uh, level best in doing the background research for this.
Right.
But
Right. Right.
yes,
Right.
we can do better.
Okay. Very good. I will let you know if I have some more opening this week because I'm delivering another 3-day program this week. That's my plan. And then after that,
Oh,
I'm done. I'm probably not gonna do that anymore. I'm just gonna
yeah,
do recording.
you,
So,
doctor, I want to like praise you for one thing. Like you have a
uh,
really good patience level that you were sitting for these many long hours for our webinars, and you know what? And you know what? The reason why I have scored this much in the step 2 CK was because of your lectures. It was nobody else that helped me to score that much. The way you told me about that signal to noise ratio and how to like articulate your thoughts well while doing the MCQ exams, it made a whole lot of difference. You know what? I did that thing like 7 to 8 days before, and my NBM 15 got me to 269 the last
is
exam.
this is it from my test taking skills? You mean?
Yeah, yeah, yeah.
Oh, I see. Okay, so you watched that.
Yes, doctor.
Okay, cool, cool. Well, I'm glad that actually helped. Yes, cool. By the way, you have anything about the Match with One interview course on those 3 days? I don't know if you have put a response or a feedback on that.
Response? Where? Uh,
The survey.
No, I did not do the survey thing.
Oh,
I
no,
will
not yet.
definitely
Okay.
do that, but I can also like tell you that it was an
Yeah.
extremely powerful way for me because it has
Uh,
helped me really transform my like the whole personality of myself. I could not think of my thoughts very clearly before those days, and now I can actually tweak everything to my liking, to the other person's liking also. So I think that that was definitely a game changer for me,
okay.
and I think that you should raise the prices.
I should raise the prices. You think is that valuable? Okay.
Yes, that is
Yeah,
totally
yeah.
valuable.
Yes. Okay. All right. Well, thank you for that. I mean, I'm going to deliver another 3 days for this week, but after that, I'm pretty much that's it. Well, I needed that because I feel like I tried my best to deliver all the things that I know for to you guys. You know, all the things that I've learned in the past decades or so. Um, and but I need you guys to tell me that it's actually working and helpful for you. So
No, it's definitely helpful, and I believe that the job that you are doing is actually making its way into the future, and you are training future physicians actually. And I think you are multiplying your effect by doing these YouTube videos. Just keep doing this work, and someday, like, I am thinking that if I am able to get into residency, I will definitely reach you out for if I want to do a YouTube channel or something. I
oh,
definitely.
sure. Remember, if you're on J1, you do YouTube.
Okay, I won't do YouTube, but oh, okay, I need to
but
find some
but
way
I
out.
will reach you out because, like I mentioned, I think I mentioned in the email that I would like to reach out to the residents, and then so they can share about their program, but also where they did the USCE. So you have 4 months, 4 months of hands-on USCE. People would want to know how you're able to do that, right? So I will definitely invite you as my guest speaker in the future because I plan to open some form of a mentorship program,
Okay.
on a high ticket offer. Yes, so I plan to do that in the future, and then so you guys can share the networking. What's the most painful part for the IMGs? Networking is the most painful part. You see,
Yes, doctor,
that's very
networking.
very painful. So I want to get rid of that pain, and one way to get rid of that pain would be to invite the residents that already matched or just recently matched, and then ask them, hey, where did you do the USC? Can you share your contacts with me? You see, so I that's what I plan to do. I'm gonna try to reach out the residents, sometimes physicians, sometimes probably do some form of a morning report. Of course, in exchange for something. I'm not gonna, hey, can you come here? No, that's not how business works. That's not how the world works.
No,
And
no,
this
no.
will benefit you as well because there is, even if you, let's say you have match, right? And then you will, I think you will match because your qualifications is just amazing. I mean, your professional qualifications, there's no doubt people know that you are qualified and you're really going to be doing really good at your job. All they need to know in during the interview, and all I need to know about you during the interview is, are you have a high one? Are you friendly enough? Are you easy to hang out with? Are we gonna have fun
Yeah,
together doing the work? It's easy for us to work with you. And that's all I need to know. I really know. This is the interesting part of residency interview process because the screening is so rigorous. So we only invite the interview of people who know how to do the job. It's very different than the other job interview out there, right? So that's the only thing that we are looking for now. So I plan to do those mentorship program and invite you. Now let's say you have match and you've done everything and you will match it next year. There is one that you don't know. That is very important. Finance. You don't know nothing about
actually,
retirement account, or do you know
the
anything
the
about retirement account, tax savings, and all those as a physician?
the thing is, like, my dad is in the board of director of Toyota. So in terms of finances, uh, he's my guru, and he knows
Oh,
much better about that.
certainly. But he is in, obviously, he's in India, right?
No, he's in Tokyo.
Oh, okay, fine, Tokyo. Um, the U.S. tax, the U.S. retirement account, their tax rules, they're very different. Yeah,
Oh yeah, I
correct.
certainly know about. I'll read
Yeah.
about them.
Yeah, Roth IRA, 401k, 403b, employer match, and all those. I know all of those because I've been working as an attending physician for 5 years. I pay taxes for 8 years now. And there are some ways that in the US that they have some rules like, You know, your house, you can have deductible and all these. They're very different. And I know that. That's what I'm going to offer to residents.
Ah,
Mm.
you know what
So,
what I love about you. You has a very good you have a very good business acumen, and you are able to capitalize it so good. And you are in the right place at right point of time in terms of capitalism.
well, okay, yeah, sure. Well, I mean, I have business coach. I learned from my business coach, so I'm not great. My business coach is
Okay.
great. And he taught me a lot, and then so I learned a lot, and so that's what I'm gonna offer. I'm gonna offer it for free. You're gonna have that for free. You're gonna learn all those for free. In exchange, please come to be my guest speaker and share your success stories. That's all I
Yeah,
ask.
obviously. Yeah, yes, sir.
Simple,
There is
right?
no, yeah,
Yes.
there
It's
is no
just
chance
simple.
that I will miss it. There is no chance that
Okay,
I'll miss it.
I will reach you out then once I start my opening my mentorship program and everything, and I'll reach you out. And then again, you will as in exchange you will get the finance course for free. The one that create the finance course not gonna be me. It's gonna be my wife. She's the one that learns all of this finance stuff. So the
Oh,
course would be coming from her.
is she an analyst, like by profession, or?
Yes, she plans to become the financial analyst and all those like Dave Ramsey
Wow.
and Ramit. So that's the plan. And so she will deliver that. She's making the course, and then once she's ready, and once her course are ready, I'll give it out to all these people, all the residents. In exchange, come to become my guest speaker and just share your success
That,
story. That's all I
that's
ask.
great.
Okay,
That's great.
and then they'll be useful for people who's joining, right? And then they got, oh, this is my connections, this is where I can get USE, this is how we get it. I try to do it every week. There's a guest speaker, something along that line. That's my plan. So yeah, you'll be one of them in the future, you know. Okay,
Thank you, doctor.
I
So
think you're
how
gonna
long have you
match. Yeah.
been, how long
What's
have you
that?
been married?
um 9, is it 9 years?
Wow.
9 years. nine
And
years
I wanted to mention that I'm also marrying the next month. I think my marriage is in like 3 weeks from now.
Oh, okay. Well, congratulations then.
Thank you,
Well,
doctor.
gonna be a lot of preparations and all
Should
that.
I ever mention this into my interview?
You can when the time is right if they ask you something more on the personal stuff.
Okay. Otherwise, no. Okay.
Otherwise, no. There has to be some value that you as that's
Deliver.
correlated to specialty that you're applying to. But considering this is a warmth type of program, it's probably useful. Um,
Mm.
so
Okay.
when they ask, I think you can put it as a joke. What's your plan 5, 10 years from now? I don't know if you plan to have kids or something. Well, I just
Uh,
get married, and you mentioned that. Oh, I'm about to. No, it's on the 20th, right? Well, first of
yeah.
all, I want to make sure that my wedding's going well, right? Jokes. I want to make sure
Yes.
my wedding's going well. But besides of that, and then you say, so that's create some warm feeling. When
Okay.
just a quick touch of personal jokes and yeah, of your personal
Yes.
life. That creates strong connections. Yeah. Okay, I'll stop the recording now.